Hi, everybody. Good morning. Come on in. I love a packed room. We are ready to get started. Welcome to our event, the Social Participation Village. The village is filling up. The village has had coffee, which is great. Thank you all for being here. We just had a packed room before this. That's 2 back-to-back sessions on social participation. So we're going to name it one of the most important topics of this World Health Assembly. It's great to see you all this morning. My name is Amy Baldasser-Bush. I'm a senior director at Management Sciences for Health, and I'm very proud to co-host the Civil Society Engagement Mechanism for UHC 2030. I hope many of you are already CSEM members, but if you don't know, we're the civil society constituency of the global UHC 2030 movement. And on behalf of our 1,700 members in 130 countries, welcome to our house, this civil society networking space, an initiative of our partnership with UHC 2030 to make sure that it's not only governments and private voices who have a place to gather and share their messages, but also civil society, communities, and patients organizations. So we're here today for this session on the Social Participation Village, where every voice shapes health governance. I'd like to recognize our co-hosts, including, and you'll be hearing from many of them in a moment, our colleagues at IAPO, at Save the Children, the Global Health Council, the George Institute, where the Sphere Project is hosted. I'd like to thank all of you for your collaboration in building this village and bringing it together. The resolution on social participation, which is what sort of kicked off these conversations 2 years ago, was adopted by the Assembly, not by accident, due to the concerted advocacy of many of you in the room, pushing for the importance of communities, civil society, patients, people with lived experience, young people, peoples in all their diversities, in shaping the health systems that are meant to serve them. And since that resolution, we've kept up the push, the advocacy to ask for implementation and making those commitments real, not talking about participation that is, thank you, not talking about participation just in name, but deep engagement in shaping health systems, and this week in shaping the global health architecture, reforms, and financing. This year is the first year that WHO has had to report on the implementation of the social participation resolution, and so you'll be hearing about that today as well. We're also going to be sharing some resources with you if you feel excited to join us in this advocacy. We at the CSEM have a social participation advocacy toolkit, and our colleagues at IAPO have a wide range of tools that you can use. At the end of the session, for saving paper, we'll provide you with QR codes that you can scan so that you can take those messages and tools with you going forward. So to get us started on the conversation about the village, I'm really pleased to introduce my partner, Danny, who is the CEO of the International Alliance for Patients Organizations. Neither of us are standing at the podium because we're too short. Stand over here. You literally can't see us. We want to make social participation visible today. So please join me in welcoming Danny and thanking you for your partnership.
Thank you so much. Is this working? Can you hear me well? So it's a huge, huge pleasure to be here with CSEM, but also our other co-hosts, because this is a moment where we want to bring more voices for the discussion. There is a whole reason behind the social participation village. And IAPO is very committed to this agenda because we are an alliance of patient organizations and we represent people with lived experience and patients who are living with conditions, and we work across all disease areas and regions of the world. And why a social participation village? We believe that health, it's something that it's so complex that we need an entire village to address what we need to build as a health system, and a health system that truly serves the people that they treat. And When we talk about a village, we also want to bring a space where we can share our views, and it's a space where we trust and acknowledge these different views and different perspectives. But more importantly, we think about how we can act upon it. So it's about learning, but also let's take it to another level and act upon it. We had a session just before this one talking about we need to generate evidence. Civil society, let's first give visibility to what's happening on the ground. Let's support this agenda as much as we can. We have been doing this for a long time. We have a lot to share, and let's partner with the right partners to turn this into evidence and turn this into a way of holding our governments accountable to advance social participation in our countries. Um, the idea here today is to, with this brilliant set of speakers, to set the scene and let you put you up to speed with where we are at the moment with social participation, what has happened, what we learned so far, and we'll have different perspectives here.
Recording in progress.
And then we'll have a moment where we'll have a discussion facilitated for us to address a few questions that we'll put forward for you to reflect upon. So now moving to the moment where we would like to share with you where we are with social participation. I'm very happy to be here with these four brilliant speakers because they have been working with social participation from the beginning. They are here not only because they are now working with it, but if it's this agenda has advanced so far that long, it's because of these people. And there is another other people as well, but I really would like to acknowledge this. So let's start with the perspective of member states and a representative of the core group who put the resolution forward in 2024. And I would like to invite Nanut Mathurapot. She's worked for the National Health Commission office in Thailand, and she'll share Thailand's work so far in this agenda.
Oh, thank you very much. And good morning, everyone. It is wonderful to be here among like-minded friends and colleagues who believe in the importance of social participation. And first of all, I would like to sincerely thank IAPO, CSEM, the George Institute for Global Health, Sphere, and Global Health Council, and Save the Children for inviting me to attend this meeting. Today, I come with two hats, one as a representative of Thailand and the other as part of the core group on social participation. The core group is made up of 6 member states, Brazil, France, Norway, Slovenia, Thailand, and Tunisia. I hope that we can have a slide on. Together with civil society partners, including CSEM, USC 2030, and WHO Civil Society Commission, and the WHO Youth Council, and of course, WHO itself. The group was formed after the adoption of the WHO resolution on social participation. But in reality, many of us already been working together long before the resolution, advocating, negotiating, exchanging ideas, and sometimes struggling together to bring this agenda to World Health Assembly. And honestly, after the resolution passed, we all realized that adoption is not the finish line, it's just the beginning. So the core group continues working through 3 things: advocacy, knowledge exchange, and collaboration with partners to prove social participation is benefit to health policies, governance, and health sovereignty. One good example was the side event hosted by Brazil early on, the central role of social participation and multilateral cooperation in advancing health sovereignty. The event brought together two health ministers from Brazil and Tunisia, representatives of stakeholders from WHO member states, including Slovenia and Thailand, civil society organizations, youth representatives, and many partners. What I found powerful was not only who attended, but the shared understanding that social participation becomes central to how we govern health. So let me leave with you with two key takeaway messages from the discussion. The first message is that health sovereignty is legitimated by social participation. Health sovereignty is about ability of countries to define and govern health priorities based on their own context, values, and people's needs. And this is exactly where social participation matters. And because when policy are shaped together with people, especially vulnerable and marginalized groups, governments gain legitimacy, trust, and strong public ownership of health decisions. And the second takeaway is this: sovereignty and multilateralism reinforce one another. Sometimes people think national sovereignty and multilateral cooperation are in tension with each other, but actually they reinforce one another. When governments meaningfully listen to their people, national priorities become clearer and more legitimate. And when countries come to global platforms, with that legitimacy, multilateral cooperation becomes more meaningful, grounded, and sustainable. In other words, strong global collaboration starts with strong participation at home. Thank you very much.
Thank you, Nanut. And I couldn't agree more how much collaboration is and it's a core issue with regards to member states and how you can learn from each other. But also, I think what Gabriele will bring now to the table and the work that the WHO is doing to guide member states, but also understand what they are doing and being there to share with the others. So, Gabriele, I would love for you to talk a little bit about the work of the WHO so far.
Thank you very much. And I would also like to start by really thanking the civil society organization that organized this side event, really for the leadership, because it takes a lot of effort from everyone to move this agenda forward. And this discussion is important. And thank you for keeping pushing for that. So I have a couple of slides, let's see if it's going to work now. Yes, it does. So I won't take much time, but basically I just would like to give a little bit of an update of where we are, because actually this year, actually on Friday, we're hitting one milestone. It's the first interim report on the implementation of the resolution that is officially presented as part of the Director General report to the World Health Assembly. So on Friday, under agenda item number 22, the report on the implementation of the WHA resolution on social participation will be presented to member states, and a discussion will follow. So important moment. It's not working. Can I have the next slide? Thank you so much. So as you know, the resolution have two operational paragraphs. One actually committing member states on a number of action, and another one committing WHO to deliver a number of action. So the report that is going to present on Friday is actually covering this second part. So it's about what WHO has been delivering. And as you know, the commitment as part of the resolution is really around documenting and capturing best practices in countries, keeping the global advocacy, producing new guidances and tools, and coordinating and supporting this report progress. And of course, also training member states on best practices. Next slide, please. I mean, I don't have to repeat why social participation in health really matters, but we know that it's really central to achieving our path towards universal health coverage. It's core to a well-functioning PHC system and PH Pro for health system. And we heard again this morning, we cannot really foster trust, inclusiveness, and health system resiliency if we don't have participatory governance at the center of how the health system functions. So there are many reasons why this agenda is more important than ever. And if we can move to the next slide, I would like to share really a little bit of what has been happening in the last 2 years. So first and foremost, you all know that the implementation of this resolution unfortunately started through a very turbulent times for global health. We are seeing, and this is also mentioned in the report of the DG, shrinking civic space, of course, deep cuts in ordinary development assistance, and many health systems, particularly in low and middle income countries, really being under severe pressure. This constitutes a challenge but an opportunity as well, because we also know that there is a growing demand for more legitimate decision from governments, more trust and people-centered governance. And I think what we heard this morning from Brazil and Tunisia are really two striking examples of what this means in practice. So it's a challenge, but there is also an opportunity because we know that many of these systems, because of all these challenges, need transformation. We talk about health sovereignty this morning. Countries want to take more ownership of their own health system. They are allocating more national core resources to that. And it's a time of shift where actually to guide these reforms and make them more legitimate, social participation really can play a core role. As I just mentioned, the political milestone of this year is this initial report, which has limitations because it's a very short report. It's only 600 words. It really captures high level what has been done. But because of that, our friends and colleagues have been stepping in as part of the core group with CSEM and others taking really the leadership as pen holder for an additional reporting that really try to capture better the nuances and the richness of what has been done at country level, both in member states, but also led by civil society. And the last point I wanted to touch upon is the work that we in WHO are doing to try to build this global architecture. I would say that the center of the solution of many of these problems is partnership, partnership, partnership. So we always wanted to work in partnership, but now it's more important than ever because we can't really progress without that. And part of this effort, beyond working within the core group, the member states and civil society organization, is also establishing collaborating centers that are going to support WHO work in this area. The director for health system of the European region, Natasha Zopardi-Muscat, mentioned early this morning that the first collaborating center on social participation has been established in the European region at the National Health Institute of Austria. We have launched last week another collaborating center based in Norway, which is actually for the well-being economy, but they have a commitment to work on social participation as well. And we are currently starting the establishment of a third collaborating center led by Thailand with the National Health Commission Office. So things are moving, but we need more to join this journey. If we can move to the next and last slide. So you will hear on Friday, as part of the report to WHA, the first interim report. It really talks about what we have been doing in terms of expanding the coalition, because as you know, the core group actually started including civil society organization 2 years ago. After WHA, we got the WHO Civil Society Commission on board, CSEM and WHA79 Force, and then the WHO Youth Council. So civil society is core part of the implementation. And it's important to say that we have been working across the house to really embed social participation in technical WHO work stream. So you will have seen, as mentioned in the report, a number of publications on primary healthcare in many disease programs, urban governance, health planning. We're really trying to capture this because we know it's a cross-cutting team. It's not something that should be a standalone. It's something that has to be integrated in the entire policy cycle and in different technical work stream of WHO. A lot of country-level momentum and exchange. The Thailand, Brazil, and Slovenia exchanges have been mentioned this morning. This is really important because it's where country meet and actually show how they do it for real on the ground. And this is really important, something that WHO is very happy to facilitate. And of course, scaling knowledge, tools, and capacity. We have held already 2 of our global webinars, reaching over 86 countries. And we have released the first 3 modules of the WHO Academy e-course on social participation. So things are progressing, maybe more slowly than we would have liked, but things are progressing. And mostly, very importantly, in terms of strengthening measurement and accountability, we have a dedicated GPW14 indicators in WHO, and we have also included in global survey metrics like the PHC surveys that our department regularly does. It features some questions on social participation. So we're really trying to embed it in our core work. And I stop here, probably already taken too much time, but this is a bit of an overview of what has been done so far. Thank you.
Thank you, Gabriele. And I really wanted to acknowledge how much work Gabriele has been doing. The context within his team has changed dramatically, and he's been really holding the fort in a very difficult situation. So I really wanted to acknowledge and continue to support you as much as possible, Gabriele. And I loved what you said about the importance of member states visiting other work on social participation, because that just reinforces how lived experience is important, so how how a country delivers social participation and use social participation in their country really helps others to learn. And with regards to the report that has been is being developed by civil society. I now would like to invite Waiswa Nawanga. He's from CSEM, and he's going to share the preliminary results of a survey that was put together to help us develop this report.
Thanks, Danny. So social participation is a very simple concept, and yet it's also quite challenging sometimes to get for people to get their heads around. And for those of you who were here earlier, you've heard quite a bit about it. But yesterday I was chatting with an advocate, and they were asking me about what this really is and what's this resolution. So in the next few slides, we will walk you through some of the basics. Let's start from the basics so that we're all starting from the same place, and then get into share with you some of the findings that we, preliminary findings that we have prepared from our civil society-led global multi-stakeholder survey that we did earlier this year. And that survey definitely was meant to really complement what Gabriele has been sharing about the WHO reporting this week. So let's kick off, next slide, please, with so basics. So in 2024, member states adopted the resolution on social participation for universal health coverage, health and well-being. And they defined it as empowering people, communities, and civil society to participate meaningfully in decision-making processes that affect health across policy cycles and at all levels of the system. And at the core of that is the placing social participation as a core function of the health system. And the resolution draws on previous commitments from ATA and also the Astana declarations on primary health care, and goes beyond that by basically mandating countries' governments to not just institutionalize, but also finance and report on progress in practice. And right now, as we're here, we realize that this is a very important moment, in part because this marks the first cycle of reporting, but also because we are looking toward next year, the high-level meeting on universal coverage that will also set the agenda for 2030 and after. And so really critical moment for us to build on the discussions today, but also on the materials that we have put together as CSEM, as other partners, to make sure that we amplify these voices across our engagements, to make sure that we push countries to go from making commitments to actually implementing social participation. Next slide. As we're saying that WHO is putting together the first report, it's been 2 years, and looking at the role of WHO in driving this agenda forward. So we, civil society and CSEM and partners, thought that it would be helpful to also try to assess what is happening in the countries to complement this reporting. And so we quickly put together a global survey earlier this year in March that we disseminated widely to try to capture what the progress on implementation has been or is happening right now. And we used the analytical framework that draws upon the 7 commitments that are in the resolution for member states, not WHO. We only looked at the member state commitment areas. And we received quite a bit of responses, especially considering the very tight timeline we had. We received about 138 responses from across different regions, and we also reviewed other resources to make sure that we're capturing as much as we can. So we looked at the UHC 2030 report and dashboard, where you can actually look at what countries, specific countries, and what they're doing on social participation. We looked at data from the High-Level Political Forum reporting from last year. And we also looked at some of our selected peer-reviewed sources to try to tease out what's happening in the countries, but also what are those lessons that we can take with us. And next slide. So in the next couple slides, I'm going to walk you through what we heard from some of you here, but also others that are not here, about what they're seeing, what they're observing at the country level in their regions. And this also went beyond civil society. We also had member states feed into this survey. We had other stakeholders also feed into this survey. And what did we hear? What we heard was that, and again, these are the commitment areas. So on public sector capacity design and to design and implement social participation, and also on enabling equitable, diverse, and inclusive participation, we heard that the public sector capacity to design and sustain participation remains weak in many settings, and that this is limiting effective implementation, even in places where participation formally, they have formal structures for participation. We also heard that participation is often project-based and also tokenistic. And we heard about this also earlier in the first session here, and the need for us to really push for meaningful engagement. And we heard that the mechanisms intended to enable inclusive participation are limited and inconsistently applied in practice. So, again, we are giving you top-line messages, but we will have a resource where you can go and read more about the preliminary findings. And then on next slide, on influence of participation on decision making and also institutionalization through policy and law, participants reported that participation is predominantly consultative with limited influence on the final decisions, and that communities and civil society actors are invited to provide input, but have little or no influence in terms of influencing policy priorities, budget allocations, or implementation decisions. We also heard that from several participants that participating structures lack effectiveness and authority. Next slide. On financing of social participation and capacity of civil society to participate, we heard that there's a lack of dedicated financing for participation. Obviously, this creates a lot of other problems downstream. 80%, approximately 80% of those who responded reported no or minimal government funding for social participation. And they also reported that consistently that the ability to participate meaningfully and consistently is widely constrained by limited institutional support, unpaid labor, and lack of predictable resourcing. And so, as you can see, this is not a sustainable situation that we're dealing with. And then last, next slide, on monitoring and evaluation and learning, it was very clear across the board that there's weak monitoring, and this really limits learning and transparency and accountability. And so there you have it. We are not doing great on implementation, but that's not to mean that there's nothing that's being done, because this is preliminary look at this. It's been only 2 years. Also, this is depending on this on a very short or small group of participants, but really gives us some insights into what's happening or not happening in terms of implementation of the commitments. So, I would like to leave with you with some very specific things that we want to see this assembly and member states do this week and beyond. And one is to really, if we can have this assembly help us to get member states to commit to meaningful participation for civil society, and to ensure that they really have influence, not just checking the box. Will be great for us to reiterate that throughout this week, and also to ask the Assembly, really to frame institutionalization of participation as a governance reform that requires formal mandates and continuity across the political cycles, and also integration into the health structures, rather than as a series of pilot projects that and activities that sometimes we see. We would hope that you can also get the message about really reinforcing the need to reinforce inclusion as a minimum standard to promote accessibility, representation, and all sorts of spaces. And also for member states to commit to the dedicated allocation of resources to support civil society and community engagement. And lastly, let's try to get the Assembly to really support integration of social participation indicators into UHC and health system monitoring aligned with WHO reporting. As we mentioned before, we have some resources that would like everybody here to help us amplify throughout the week and beyond. Thank you.
Thank you, Wazla. And just to reinforce this, research will continue. We'll talk more about this at the ending, but we'll invite you to fill in the survey and share it as widely as possible so we can capture more. And of course, a lot of what we heard today is about the gaps and the challenges that we are facing, but I'm happy to invite Nina Joshi from the George Institute for Global Health, who also talk about some learnings and how evidence is showing good practice as well. And over to you, Josh.
Thank you. Can everyone hear me? Perfect. So I just want to start by saying thank you so much for having me here today. I feel so lucky to stand between two of my sphere colleagues. So it really shows that all of us are working together to advance social participation for health. So as mentioned, oh, can I have the next slide? Oh, I think. I don't know if I did that or if you did that. Okay. So as mentioned, I'm Nina Joshi, and I'm the Senior Project Manager of the Social Participation for Health Engagement, Research, and Empowerment Consortium, or SPHERE, at the George Institute for Global Health. And today I'm going to speak a bit about a model of collaboration that we have used and we're trying to understand and to see if does it actually advance social participation for UHC? So we're in the crux of conducting the evaluation on this, and as we start to see some emerging findings, we're happy to share them with you today. So for some background, could I have the next slide? SPHERE is a multi-country collaboration model of country-level CSOs and research institutions, as well as global-level diplomacy and research institutions who are all committed to advancing UHC or SPH for UHC. From 2022 to 2026, SPHERE has brought together CSOs and research institutes in Argentina, Kenya, and Vietnam, along with CSEM, UHC 2030, the WHO, and the George Institute for Global Health, where the Secretariat is anchored. And all of us are working together to advance SPH. Okay, here it is. So the way that SPHERE has worked and the collaboration model that we've used, and as you mentioned in your talking points, there's a lot of collaboration going on and a lot of institutes are being created, but what does that look like, right? And how are we actually going to advance SPH? And what we adopted is an academic practitioner interface. And what this means and why we chose this is we wanted to leverage the expertise of each partner and advance the group's mutual interests. And as you probably have gotten by now, the mutual interest is to advance social participation for health. And what that means is that global diplomacy actors were really focused on shaping the agenda of SPHERE and facilitating institutional uptake. Our civil society organizations were focused on leading community engagement and focusing on advocacy efforts. And then last but not least, the academic and research institutions were very much focused on generating rigorous evidence. So now that we're coming to the end of the project, what we're trying to see is, was SPHERE and this model of collaboration able to do this? Were we able to, in some way, advance the documentation of social participation for health? So to conduct this evaluation, we used a narrative evaluation approach. And we chose this specific methodology because it mirrors the SPHERE collaboration model. It emphasizes co-production, it's highly reflective, and it's context specific. So I'm not going to spend too much time here, but I do want to briefly go over the different ways that we collected the data and then what the evaluation results are going to look like. So we revisited the theories of change frameworks that each country partner created at the beginning of SPHERE through a workshop, and we worked through what actually happened, what were they able to do, and what changed given the socio-political context that they work in. We also conducted 15 key informant interviews with most people involved in the SPHERE project. And then we invited reflections and learnings from not only the country partners, but everyone involved in the project. And this was done over a series of workshops over the last 6 months. From these 3 data collection processes, we're going to result in kind of 2 forms of findings. So the SPHERE evaluation is going to result in credible stories of participants' lived experiences, as well as priority good practices that fit for diverse contexts, which actually advance social participation for UHC. So getting into some of our emerging insights. At the global level, so in the 3 countries that we're working in, our emerging insights are revealing that the SPHERE model of collaboration, so this academic practitioner collaboration, reshaped actors' view of social participation for health, of UHC, and the role of research in advancing social participation for health. We're observing that SPHERE facilitated the introduction of WHO's definition of social participation in UHC. to country-level partners and also supported their use of the WHO Handbook on Social Participation for UHC and the Civil Society Advocacy Toolkit on SPH. We're also seeing that Sphere created linkages between global diplomacy and country advocacy. And last but not least, we're seeing that Sphere innovated modes of collaboration between advocacy and research activities, specifically adapting research methodologies to reflect and document social participation for health. Next slide. Thank you. So here, I just wanted to share two quotes from some of our interviews. These quotes are from two different participants. And here in the first one, the quote reads, "Previously, when we talk about participation, some staff would think, oh, participation is inviting the community people. Some of them think that participation means that you engage them in all steps of the project. And some of them think that we engage them in the policy process only. But I think we now have the same understanding about social participation." And I'm sharing this quote with you today because along with the introduction of WHO's definitions of SPH and UHC, we're also observing that Sphere and the collaboration between global diplomacy, institutions, and country partners may have had a broader organizational impact. And the second quote here is from a different participant who states, "I usually hate focus groups. But Witness Seminar flipped around the project. This change in the perspective where everyone has to present their voice, everyone sitting will tell you what they feel, and we're not going to confront, we're not going to see who's right, who's not. We're just going to hear everyone. It was really a change of perspective and an opportunity to understand a complex concept." And I'm sharing this quote because I think it does a beautiful job of exemplifying how the Sphere model of collaboration, which connected researchers across countries and research institutes across countries, not only introduced methodologies to document social participation for health, but it's also reshaping participants' perceptions. Next slide. Thank you. And I wanted to also share some key insights from each of the Sphere country partners. So in Kenya, through the Sphere collaboration, the collaboration between global diplomacy actors, the CSO partner, and the country-level research institute contributed to the CSO's partners' engagement with the National Public Participation Bill discourse. Here, a participant from Kenya said, "Originally, we looked at health forecast bills like maternal health and immunization, but public participation is cross-cutting. If we had not been doing this Sphere project, we may not have thought to push for public participation. Because we were in the throes of looking at the research findings and seeing that community awareness is lacking, we said, how do they get involved? For me, I can relate Hennet's engagement with the bill directly to the Sphere project." Next slide, please. Thank you. In Vietnam, we are seeing that collaboration with a country-level research institute enabled the CSO to become a research-grounded advocacy partner within health governance spaces. Here, one of our Vietnamese colleagues states, "We, as in the CSO collaborator, carry out our own research, but sometimes our data was denied by the policymaker because of lacking the appropriate methodology. Some government agencies or policymakers will deny using our data because they say we made the data for policy advocacy, because no one checked it and it does not follow a professional methodology." They go on to say, "From there, as in the social or the policymaker's perspective, the evidence or the voice from the university seems neutral." You can have the next slide. Thank you. And lastly, in Argentina, collaboration among country-level research institute, a CSO, and local community groups facilitated communities' assertion of ownership over their data, claiming power in their relationship with CSOs. Here we have a quote from one of our participants in Argentina, which reads, "When the situation was getting very difficult with police violence in Argentina, a demand came from Ada and Amar saying, 'Can you please put in a report everything we have on violence and health?' Because we've been talking about advocacy, how to get advocacy, and what advocacy is for, it actually made the click. When we prepared that report, it was beyond what we had been doing with Sphere. It was a recollection of everything that we had done. There's something about Sphere that is materializing things. Could I have the next slide? Thank you. So in summary, what we're seeing from the Sphere model of collaboration, which is an academic practitioner interface, is that first, global advocacy exposure helps shape local advocacy and policy influence, that co-production strengthens evidence legitimacy and uptake, and that through academic practitioner interface or collaboration, communities become active agents in evidence and advocacy. We also saw or are seeing that academic practitioner collaboration drives conceptual alignment and policy coherence. Next slide, please. So with that, I want to say thank you. Oh, yeah. Thank you for your attention. I also want to take a moment to thank the Sphere team, some of whom are in this photo when we were all in India in March playing Holi, and also the Sphere evaluation team who has been instrumental in making sure these results are emerging insights were ready for you today. Without their guidance, leadership, and expertise, I wouldn't be up here today. So thank you.
Thank you, Nina. And I hope with these interventions now you have an overview of where we are with social participation, what each stakeholder group has been doing and can do, and inspired you for the next section of our event, where we'll now have a facilitated conversation about how we can take this forward, what is happening around the world, what each one of us is doing, but also are there any opportunities for us to work together, to collaborate, and to advance this agenda further? And to do this brilliantly, I would like to invite, before, I would like to thank you so much for the speakers in the panel. And I would now like to invite you to join everyone in the arena that we are going to start. And to facilitate the discussions, I would like to invite Ravi Ram. He's from MedWise Solutions, but also he's the co-chair of the WHO Civil Society Commission. And he will make this conversation very lively. Thank you, Ravi.
Can you hear me?
No, but
Let's first give a round of applause to Danny Nanuj Weiswald. All right, we're going to get started with an interactive session. This is where we really become a village. So to get ourselves set up, we have a little bit of work to do. I want you to stand up and take your chair and just rotate it so that we all face the center aisle. We see each other. This is looking very good. And while we're getting organized this way, we're going to keep 4 chairs in the middle, and we'll keep them empty at the moment. And it's an invitation to others to come and join, for all of us to come and join. I think we're largely organized this way, and I'd like you to stand up again, not just yet, for those of us who bring lived experience to the room, patient groups, working with others, caregivers, health workers. Let's let's stand up if you feel you fall into any of those categories, any of these people. Anyone with lived experience that they bring to social participation. If you have working with patients, you are a patient, you're a caregiver, you're a health worker. Let's see you. So we have a good number that way. Thanks very much. I want to see the diversity in the group. Can you hear me okay? Because, okay, good. I'd also like to just recognize that we have Nanut with us, representing a government perspective. We had Brazil in this meeting this morning. If you represent government, policymakers, decision makers from the national authorities, please do stand up because we want those perspectives coming as well. Good. No. We're happy to have you here, so no, don't hide. Okay, so we do have a few voices. We're going to look to you. Who is here from the advocacy perspective? And you may overlap. Working in advocacy, working to bring the large number of people. Good. Very good. And others of us in civil society, maybe working in research. We heard from Nina, yes, working on evidence, working on bringing points forward. Very nice. And then can I ask those of you who have not yet stood up, stand up and just yell out, who are you? No, yes. No. If you've not yet stood up, stand up now, please. Yeah, okay. There we go. Yes. Thank you very much. And Gabriela, do you want to stand up and with with Ida? Yes. Okay, good. What we're seeing and hearing is that we have a large number of people from different parts. And can we turn to Laura also? I think we're hearing a little bit from those who are online, right?
Can you hear me now? Yes, just to make sure when you take the front stage to also speak in the mic, we have over 65 participants online who are also participating in the chat. So yeah, make sure it's inclusive until the end.
Thank you very much, Laura. Now, what we want to do is to get perspectives out. And as Danny introduced the session for us, we know that there are several different pieces. We want to hear actually what's happening, right? A little bit of feedback about I tried social participation or I was part of it, and here's what worked, here's what didn't, right? And then we'll move on to a few other questions looking at who's actually participating, what's being left out, and then we'll try to conclude by what do we do next? And I think some of the points that came up, Nina was giving us some very critical feedback from the survey that Sphere has conducted. So are we together? Any questions? Suggestions from the group? What do you want to hear? Disculpe, yo no hablo portugués, pero hay muchas personas que pueden sí. ¿Estamos juntos? Sí. Okay, so let's get started. A few people, let's hear from you if you have experience in working at social participation in your home context. Something that you've seen, I'd like you to come and take 3 of the 4 chairs here. ¿Sí? Siéntate.
Hello.
Okay, yes. So let's let's hear from our people here. Now, the structure here is that we have 4 chairs. We have 3 people seated. As you hear what they're saying, thoughts may come to your mind. It may trigger something. Let's have you come up and take the 4th chair. And when one of the speakers is done, they will go back and sit down. So we're always rotating and we're hearing from different people. We should be in motion. We're a very active group here. All right? So let's hear from our first speaker.
I'm just going to translate.
Of course.
Uma experiência de participação social só acontece com conquista de democracia e soberania nacional, no diálogo multilateral das agências e das instituições de saúde.
A social participation experience only happens when we have multilateral cooperation, health sovereignty, and collaboration between health agencies. And democracy, of course.
Okay, thank you. Yes. All right, let's pass the microphone to the next person.
Hello. I'm Antoine. I'm from Canada. I was super struck by all the presentation. My experience from Canada of social participation resonates very much with the findings of the survey that has been done by CSEM. What strikes me also right now, 2 years after the adoption of the resolution, is that WHO is accountable to member state, but member states are not accountable to each other and to their people. I think we need to hear these voices very much, to bring them back. I was also struck by us talking about bringing people at the table. I think we need to talk about tables. There's many, many tables, and we need to multiply these tables. The third thing that struck me is the role of research for creating new tables. Stable tables where we can bring different perspectives of people who don't necessarily work together already and who can align their powers actually for change. And I think that's an important contribution of research moving forward. So thank you very much for the presentations today.
All right, thanks very much. We've heard from a brother from Canada, a sister from Brazil, I believe, right? Let's have more voices coming up. We do have empty chairs. And I very much encourage those online, please do type in the chat. We're looking for your perspectives as well. Let's turn to Sarah.
Hello, I'm Sarah. I would like to share an experience we had in Madagascar in a project that I supported. So it's right, you need to have the right people around the table, but you also need to make sure that these people are actually empowered and have the right capacity and understanding to meaningfully engage and contribute. So this is something we learn very strongly with the processes we try to support it there. So it means that people need to have the capacity to speak the same languages. I mean, really speaking the same languages in practice, but also being able to understand each other and to respect each other. It also brings to my mind the fact that this social participation needs to be in what we can call a safe space, because you are bringing around the table people that can have different hierarchical level, that can feel pressurized because they have this and this authority around the table and they are accountable to them or feeling under pressure. And this is also something that should be addressed in practice when the social participation mechanism or process is thought through. This is a very practical issue, but this is actually the main barrier we encountered in the project we supported. And I think it's also something that should be thought through at the beginning of the reflection, and that should be institutionalized, etc., etc.
Mm-hmm.
Thank you.
Thank you very much, Sarah. We do have a comment online. I'm encouraging people to come up and sit in the chairs. We're hearing a lot. The conditions. Our sister from Brazil talked about what's required to make social participation happen. We're hearing about accountability, multiple tables and fora. Let's turn to Ritu, and then I'm going to turn to Laura to hear from our people online.
Thank you. I'm from Singapore, and I hope we're not going to be quoted on what we say here. I think social participation works well in regions, in countries where people feel safe to speak, where they know that participation or intention will not translate to censure. And I looked at the numbers that were shared in the report. My region, Western Pacific, has 2% of the total respondents come from Western Pacific, which has close to 2 billion population in a global population of about 8 billion people. It's 25% and 2% representation. I mean, not a response, not representation. This is perhaps the region where in many countries social participation is not encouraged. And that to me is telling that we need to put in effort, no matter how difficult, in creating safe spaces, in creating, what did you say, stable tables, Antoine, where people feel safe to participate. And fortunately, I also come from a university. I work in a university, and I feel that's a great space that cuts across and enables a safer space, a neutral space, which also was shared in the report, that we need more of these spaces. So perhaps that's some food for thought here. Thank you.
Thank you very much, Ritu. At this point, I want to hear from our people online. Laura from CSEM is going to read out one of the comments that's come out.
I'll pick your mic for a second. Yes, we have a strong participation online too, and great comment from several people online. Apologies if I'm mispronouncing any names here. We have Nadia Latif, who wanted to highlight that it just not build a new, be at the table, but build a new seat at the table for civil society, and highlight the need for intergenerational participation and voice. And she was rightly highlight that children and adolescents and older people are facing the same issue in terms of, or similar issue in terms of regimes. And she is working specifically to ensure that people are not discriminated based on their age. We had other comments. Sorry, I'm going to pause my computer over here to read it too. Thank you. Other comment from different region, great comment from the setup and people who would have wished to be here today with us. We have comment from Malaysia, also on exclusion of people living with rare disease and the importance to make sure that this is comprehensive to everyone, and how do we make sure that we include everyone and make UHC and social participation while not excluding also a specific disease area in the process. Good, and we have also a comment about the question online here, about the question featured, and a particular interest about hearing more about the biggest challenge to make social participation a reality in the different contexts, and your advice in your advice to ensure social participation. So one challenge and an advice. Thank you.
Thank you, Laura, and thanks to those online. Very much appreciating your contributions. And let's keep in mind, we're not just having a one-time session. The questions we're talking about, the ideas that are coming forward, are very much linked to the survey that was conducted. Nina's presented the interim results, and we want to take it forward. So we'll get there. We've got several people in the middle of the room. Let's hear from you next.
Yeah. I'm Fernanda from Brazil, but I work with international organizations around the world. And what I've been learning is that if we are not seated around the table, we are going to be in the menu. Mm-hmm. And I think we don't want to be in the menu. And what I think is missing is more young people discussing with us. It was nice to hear from the online participation, because we are always putting the hope on young people, but we are putting a lot of pressure on their shoulders as well. And how could be more easy for them to do the changes that we are looking forward. And also we are talking about democracy that she mentioned, and the political will is not from people that there is nothing to be with us because we vote for them. So the political will comes from us, not from other person that there is nothing to do with our decision.
Great, thank you.
Thank you. This is Valentina from Humanity and Inclusion and World Rehabilitation Alliance. I really appreciated some comments regarding the conditions that need to be in place to have social participation. And I would add there that it's even more than conditions. It's really about also intentional measures to make it happen. And I'm thinking in particular about the participation of specific groups, including persons with disabilities, where often spaces that are created to facilitate social participation don't take into account specific barriers, whether they relate to stigma and discrimination, or also barriers that relate to communication, physical accessibilities, access to information. And that's true that this requires extra steps, intentional steps that need to be made, and organizations of persons with disabilities can be there as allies when social participation processes are in place to advise which are the actions that need to be taken to include persons with disabilities in the conversation. Thank you.
Hi, my name is Nicola Bedlington, and I'm working with patient organisations at European and at global level. And I just wanted to give you a quick example of where social participation worked well in a European context, but where there's some significant unfinished business as well. So we're looking at the cardiovascular health space as a great alliance of organizations working on cardiovascular health, and they pushed very heavily at European level for a European-wide robust plan on cardiovascular health. And the voice of people with lived experience was absolutely vital in encouraging a positive decision. So the EU institutions said, yes, we now have a great plan, the Safe Hearts plan, but unfortunately two problems persist. The first problem is there is not a sufficient budget to fund an ambitious plan that will actually look at reducing mortality by 30% in the context of cardiovascular diseases, but no funding for civil society to play a meaningful role. That's the first big problem that we need to overcome. And the second big problem is that there's no people with lived experience representation from civil society in the governance of the plan moving forward. It is governments, it is researchers, it's officials, but the voice of civil society is not there. And we've seen this before. A previous European plan on beating cancer had exactly the same problem at the beginning. Civil society in the cancer field fought hard, fought strongly and won, and they were in fact part of the governance. People with lived experience also part of the governance, and that has resulted in a very, very effective plan with real impact on the ground that actually responds to the needs and goals of people with lived experience, people living with cancer and their communities. So that's a really, I think, interesting example at European level of getting so far, so well, and then still having problems and challenges to overcome. And while I still have the micro, I just wanted to do a big plug for the fantastic work that IAPO has been doing and some of the resources and tools that they are co-creating with communities across the globe. And on the theme of leaving nobody behind, really checking in with communities that are perhaps most left behind to make sure that those tools are fit for purpose. So those will be shared after the meeting, I understand, and certainly they are very, very applicable in a European context and elsewhere. Thank you.
Yeah, thanks, Nicola. And it's worth noting There will be QR codes that come around so you can download documents, you can carry material with you as you go back home. All right, let's hear from our next.
Bom dia. Vou falar em português porque eu não falo inglês, mas Nath está aqui. Bom, eu sou Janaína, sou secretária executiva do Conselho Nacional de Saúde do Brasil, né?
Good morning, everyone. She didn't speak English, but I'm here to translate for her. She's Janaína Salles, the Executive Secretary of the National Health Council of Brazil.
Bom, a experiência que eu queria trazer aqui é uma experiência de participação social relacionada à incidência política e de atuação na formulação das políticas públicas de saúde do Brasil e na implementação das políticas.
The social participation experience I would like to share here today is on the incidence, political and action incidence of the social participation in the public health policies in Brazil.
No Brasil, nós tivemos já há 2 conferências uma experiência importante, que é a formulação de propostas na área da saúde a partir da comunidade, e não após a formulação pelos gestores, mas sim a partir do território.
In Brazil, with the National Health Councils, we have National Health Conferences, we have an important experience of having the social participation active before the policies are implemented and decided, but participating during the entire process.
E essa experiência, ela traz a incidência, né, das comunidades, dos pequenos locais em que a sociedade participa da saúde, propõe ações para melhoria da qualidade de saúde no seu local, e que incidem nas 3 esferas de planejamento do governo, né? Então, esfera municipal, esfera estadual e esfera nacional.
And this experience brings voices from people, from communities, from territories, from small places to the public health policies and to the national decisions.
E essa incidência, ela faz com que a gente tenha propostas que sejam avaliadas pelos gestores, compartilhadas e implementadas posteriormente de acordo com a coerência e a necessidade da população.
And with this experience, we share our expertise and our knowledge and lived experience with the managers from the health system, so that it can be incorporated into our national policies and can influence in all the context of the country, in the municipalities, in the cities, and in the national level.
E na prática, isso se reproduz como não só propostas, mas incidência no planejamento orçamentário e financeiro da saúde, né? Então, a gente tem, a partir das conferências municipais, estaduais e nacional, a proposição e a previsão de recursos de acordo com aquela realidade que está sendo proposta, né? De acordo com as propostas que vêm das conferências. E isso tem tornado as políticas públicas mais próximas da realidade que a população brasileira tem.
And the proposals that come from the conferences, they are also influenced on budget and resources, and so that the budget and resources allocations can be more close to what the society and the civil society needs.
E por fim, essa incidência, ela também ocorre na fase de implementação dessas políticas, né? Em que os conselhos de saúde, a sociedade participam do monitoramento de como acontecem essas políticas, né? Se elas de fato estão mudando a realidade social, se elas de fato estão alcançando e ampliando o acesso à saúde das pessoas. Então, essa é uma boa experiência que nós temos no Brasil.
And to close, And to close, we would like to also share that the civil society, the social participation is also present at the implementation of policies. So not just in the construction, but also in the implementation, the monitoring, the evaluation, and the follow-up on the policies. Thank you, everyone.
I think this is great. We're hearing a lot from a range of questions. Examples of where things have worked or not. Who's involved? Let's get a little bit more on that. Who is actually socially participating? Who's invited? And who's being excluded? And then also, let's hear a little bit more about what's next. We're hearing a lot of critiques, some are good examples, some negative, but what do we need to do next? Because we don't pretend that we've worked it all out right now. We need to think about what are our next steps. But let's hear from the next round of speakers, and then we'll check again online and encouraging more people to contribute on the online chat.
Am I audible? Yeah, great. I am Mani Chandana. I am from India, and I'm here as part of NCDA's Our Views, Our Voices fellow. I am one of the selected fellows to advance on my advocacy goals. I am here also sitting in this chair as a person with lived experience. I face the double burden of living with chronic asthma and a chronic neurological condition called multiple sclerosis. And thanks to all the speakers earlier who talked about safe space and not just providing a table, but tables, and then the importance of collaboration between member states. On that question of who is being excluded, I think exclusion is being done I think it is being done very strategically. I would say gay men and any like queer community and sex workers and the poorest of the poor. I think their voices are not being heard yet, and and also like I have had an experience of being on a consultation call as part of a focus group discussion, but then where did my input go? What happened after that? I was not being informed on that, and whom do I reach out to once the call is over, right? And if I am not part of these decisions, then it is not true social participation. Access is not being given to me to sort of like understand where the information that I am giving is going and what kind of a difference is it making. And only when I know that kind of a input can I talk about the importance of it to my peers, to my community. And also, I think the biggest challenge is stigma. Like earlier, someone said, my mom asked me the question, "How did you get into the fellowship?" And I told her, "I exactly did what you asked me not to do." Right? She asked me not to talk about my condition to anyone. Right? So that's the kind of rooted stigma we have, and we all have to tackle that stigma in order to make people empowered to speak about what they're facing, not just in their day-to-day lives, but also what kind of difficulties are they facing in their interactions with the primary healthcare systems. Yeah, I think this was what I think would help all of us to come on the same page. Thank you.
Thank you very much.
Hi, everyone. My name's Bethany. I'm Australian, but I'm currently based with the Harvard Medical School's program in global primary healthcare. And I work on a commission for people-centered care for universal health coverage and have some allies and colleagues in the room on that. So the experience I want to speak to is based on that commission. And the commission is really, I hope, helping to advance this agenda in two ways. One is that one of the core objectives of the research is to demonstrate practical ways that we can create people-centered health systems. And for that, there needs to be voice, individual voice, collective voice in design of those health systems and policies. And the second for us is that the way we're doing this commission, the way we're doing the research has to be about meaningful engagement. Ultimate failure mode for us would mean to not do that well, to fall into any of the traps we've heard today around tokenism, around voice without influence. And what triggered my thought was this talk about multiple stable tables and being in motion. And I think some of the tensions we've experienced have been because in our attempt to create safe spaces where lived experience can come and share, we end up creating silos that where that experience is not actually it's remaining in an echo chamber. And so that tension of the safe space but also the integrated space. I think another tension has been, although we were very intentional about seeking out lived experience, there's 40% of our commissioners identify as people with lived experience. They also identify as researchers and policymakers, and that none of us are actually wearing one hat. And so being able to get up and move to the other table and for that expertise to be recognized on equal footing. And the third tension, I think, is that despite our best efforts, again, to bring in multiple diverse voices, we recognize that the people who have the capacity to be involved in initiatives like this, they may be from different countries, different gender identities, other different demographics, but they're still generally amongst what we would call the global elite. They're people who can afford to be in these rooms, can afford to do work for free. We try not to do that. We do pay our commissioners, but and so one of the things we're trying to do is to reach, quote unquote, the margins, to do focus group work in areas that are not otherwise reached in many virtual forums. Sorry, not virtual forums, in-person forums in settings like Geneva and New York. So, but that takes time, that takes trust, and equity is expensive. And I think we need to, we need to acknowledge that, and policymakers need to acknowledge that and need to front the resources for that and pay what it takes. So there are a few of the things we're doing in research, really inspired to be among you. I think we need stable tables in motion, maybe like a sushi train. I can't think of a better analogy right now, but there's something about that, tables in motion. Thank you.
Thanks very much. We're going to be wrapping up soon. Very soon you'll see the QR code on the screens in front of you or online, and that's to enable you to contribute further ideas or to capture what you've heard today or said today so that it can be in the report. We are sharing ideas openly right now, and we want to build on that. We've got 3 speakers left to conclude with us, and then I do know that we have a few member states, looking at 2 of you, and then also a few people from WHO. We may hear just a few brief words as we conclude, but let's go to Amanda next.
Hi, everyone. My name is Amanda Bach. I'm here representing the Global Patient Movement Catalyst. I also work for the Synergist. Many of our partners and allies are in the room. I so passionately agree with everything that everyone has said. Equity is expensive. I think that's a beautiful way of saying the resourcing. Nicola, you made this point as well. In Europe, we're even losing ground on that, especially the resourcing, less for service delivery and co-delivery and more for the governance, co-decision-making piece. The safety element that Ritu brought up, the stable moving chair idea, table idea of Antoine. Not to repeat everything that everyone has already said, looking to the future, I challenge us to think about the next hurdle. And I think we need to be connecting the stable moving tables. And I'm just going to say sustainability. We're not connected to the sustainability agenda. We see wonderful theoretical connections. It was great to see the health action plan that came out of Belém in Brazil, notably mentioned social participation. That's wonderful. But even amongst civil society, I would challenge us to say that not all civil society is equal. And what some civil society can do, especially in the environmental field, is far more powerful than what the patient part of civil society can currently do. And as you know, we're working on that in the Patient Movement Catalyst. But the idea of if we're not at the table, we'll be on the menu is absolutely true. We're already seeing that those that are very powerfully moving the sustainability agenda forward are not realizing that that's going to come at a cost of their health. We have the PFAS agenda, we have the chemical agenda, we have a lot of decisions that are being made without people with health lived experience. that will affect their treatment products, that will affect what they can have access to or no longer have access to because it has too much of a carbon footprint, because we within civil society have not connected those dots. So as we are doing a great job in Sphere and other places to connect academia with policy, connecting the global diplomacy with the local work, let's also connect the environment agenda with the health agenda and help lived experience voices have the same resourcing as others in civil society.
Então, bom dia, sou o Fernando Pigato, eu estive presidente do Conselho Nacional de Saúde do Brasil até o final de 2024 e agora estou aqui hoje a convite do Conselho para essa avaliação dos 2 anos da nossa resolução, porque a gente ajudou a construir.
Good morning, everyone. His name is Fernando Pigato. He was the president of the National Health Council of Brazil until 24, and now he's here invited by the National Health Council as a consultant.
A gente fala no Brasil que precisávamos agir local e pensar global. E a gente passou por um momento que a gente precisou resistir muito, né? E isso coincidiu também com a pandemia. E a gente não deixou de investir no local. A gente tinha conselhos locais de saúde e a gente, a partir de 2023, como tivemos a democracia voltando ao nosso país, nós inclusive deliberamos numa conferência de saúde que essa seria uma prioridade, fortalecer e criar conselhos locais de saúde nos territórios.
Pigato mentioned about we need to think globally and act locally, because in Brazil we've been doing it, especially since 2003, when you have a democratic government back, and we've been working hard in the local health councils in Brazil to do this kind of job, acting locally, but thinking globally.
Outra questão que a gente fizemos como prioridade foi formação para as pessoas atuarem no controle social, na participação social. Lideranças de movimentos, de entidades e conselheiros, inclusive, de saúde. Então, estamos esse ano completando 10 anos num projeto chamado Participa Mais, que teve um momento difícil, mas que a gente continuou fazendo e que agora, com o governo democrático, multiplicou em 3 vezes os recursos para esse projeto ser implementado. Hoje são mais de 50 mil pessoas que já passaram por esses cursos de formação.
There's something really important for us in Brazil about social participation that is regarding formation. We've been working on a project for 10 years called Participa Mais, that we work with counselors, stakeholders, people from the territory to bring the information about social participation in the policies. And we had like 50,000 people being formed by this movement, by this program in Brazil, especially in this democratic government now that we had funding for it.
Foi somente com o governo democrático que a gente pôde fazer parte, né, da construção da resolução a partir de 2023, aprovar a resolução em 2024 e agora ajudar a implementar. Mas a gente precisa escrever essa história e a gente precisa fazer com que ela seja contada depois para ela não ser esquecida e para que a gente não tenha retrocessos como vivemos até um tempo agora há pouco. Eu hoje estou fazendo um mestrado, né, de participação social, saúde pública, que inclusive é um mestrado hoje organizado pelo Conselho Nacional de Saúde, o Ministério da Saúde e a Fiocruz do Brasil.
Great. This process we've been doing since 2003 is just possible because you have a democratic government who is pushing us to do it, especially because we have now masters in social participation in Brazil. This is a kind of new thing that we are doing. He's a student of this masters in social participation in Brazil, and we think we need to keep telling this story. We need to tell to everybody how we can improve it and keep moving forward to do it. Thank you.
Okay, I will keep it briefly. Thank you. Okay. I'm a physician in internal medicine, and I'm from the invisible country during WHA. I'm from Taiwan. Nice to meet you. No pressure. Yeah. And I just to share one point is that because I'm also the influencer in my country, and I also have a collaboration and the advocacy within the civil society, have some recommendation to the government, and maybe somebody here know we have the national health insurance to have the coverage, to have the 95% care service to the all our citizen. And but there's a problem. We have a comprehensive services, but when we discuss something based on some truth, so what is the data? The data is not transparent. So when we do the civil society discussion, everybody is not on the same page. So one thing is very important is that to have the data to be comprehensive and be transparent to the civil society to do the further discussion, and we will have all of us on the same page to have a good social participation to the government for further discussion. Thank you. This is my point. Thank you.
Thank you very much. Our last speaker is from Brazil. We're very honored to have so many speakers from a dynamic country, and I believe you're speaking about health workers.
Hi, I am Ana Carolina Freire. I am a psychologist at the Federal Council of Psychology in Brazil and council member at the National Work Health Council in Brazil. I'm here to represent the health workers. I'm in the social control with the Brazilian UNIF, the health system. Participation is organized in the three-part system with manager, health works, and service user take part in councils and conference. This structure support shared decision-making in public health policies. The participation of health work face challenges such as unequal power in decision-making, difficult work conditions, fragment representations, and gap between decision and the implementation. There are also territorial, social, racial, and gender inequalities that shape how workers' participation. Even with the challenge, the involvement of health workers is essential. They bring direct experience for daily care and service organization, make social control more grounded in real rights needs. Strategizing their participation means improve the quality and fairness of health policies in the SUS.
Let's have another round of applause for all our speakers. We heard quite a lot. And very relevant for social participation, we're hearing about the tensions between those who have power, whether it's financial, technocratic, political, and those who are struggling to get their voices in. I think that's the reason behind the social participation resolution and where we need to go next. Fantastic session. I'm going to turn it back to Danny. She's going to lead us to the end and show how we can continue to contribute to this dialogue. Danny.
Thank you, everyone. Thank you, Ravi, for this excellent facilitation. But thank you, everyone, as well, for bringing your experiences and insights. And also thank you for staying till a little bit later than expected. I just wanted to draw your attention to a few resources that are available right now. There is the CSEM toolkit on social participation, kind of unpacking what's in there in the resolution, what civil society can do. IAPL also developed a resource with our patient community and WHO, CSEM, other strong partners, unpacking the resolution, social participation through the lenses of patient organizations and how they can move this forward in their countries. But also, remember, we talked about the research that started and we presented a few preliminary results. This will continue to be available because we want to continue learning what's happening on the ground and resharing with everyone who's working on this for us to learn and build evidence that it's much needed to inform member states. But also we started an effort to create a stakeholder map where I hope you, when you registered for this event, you were offered the opportunity to share an initiative that you are doing on social participation and where you're based, the name of your organization. So I hope the map will pop it. Yeah. So we started populating this so we can have an idea of who's doing what and start to create more connections, more collaborations, and more learnings for us to move forward together with this agenda. We'll be in touch, sharing the link for you, anyone who wants to be included in this map. So please share this widely. And also, one big idea that we are discussing, should we continue with this social participation village? Is this a good space for us to continue this conversation? Is this a good format and so on? So we'll also be bringing back this question to all of you because we believe that there are a few voices missing. The space is here. Let's bring these missing voices and let's think what we can do to act upon all these learnings and these insights that we have been sharing here. A big thank you for everyone, for the speakers, for the facilitator, for the participants, but also the co-hosts that did this event with us today. And I really look forward to continue this conversation, but also what we can do in practice to really advance social participation in our country. Thank you so much.